You guys just let me know when you're ready. You ready? You guys ready? Okay. Thank you guys for coming out today. As you know, on Monday we put out a press release that we'd had our first case of COVID in the jail. That prompted us with our medical staff. And first of all, I'd like to say thank you to the Arkansas Department of Health and our medical partners, Trinity, with helping us stick to the CDC guidelines. And we are working hand to hand with all of those involved with this to assure that not only the inmates are taken care of and healthy, but also our employees here. After Monday, we were prompted to test everyone in the facility, including all of our employees and all the inmates in there. With that being said, we have some of our test results back. We still have some pending, but for the majority, they are back. As of now, we had 164 inmates have tested positive for COVID. Of that 164, 163 are asymptomatic. We have one that had an underlying health issues. He's now receiving medical treatment at a local hospital. Of the employees, we tested all the employees, close to 300. We had 13 of those that came back with a positive result. All those being inside the correctional facility itself, except for one civilian employee. None of our field deputies tested positive. And there are, let me preface that with the cases that are inside the jail. It's not everywhere in the jail. It is isolated to a couple areas within the jail. If there could be any good out of this, that is a great thing for us. So we're going to be able to isolate and separate those individuals. There are areas of the jail we have 0 results. We have started this process early in March. We've done really good at avoiding this, but unfortunately it's here, and we knew it probably would be at some point, but we avoided it as long as we could, keeping the inmates safe. One of the things that we enacted back in March with the quorum court was to provide free medical to the inmates. That's been going on since March, so that they felt free that they could come to the doctor if they had any type of symptoms. And we're going to continue that policy going forward until we get through this crisis. How long that will be in our country, we don't know. Jail personnel will be required to wear a mask. That's one thing that we have been doing. Field deputies, when they're interacting with the public outside the car, they're required to wear one. But I attribute the mask have worked really well. We are providing masks to the inmates. If they so wish to wear it, we can't require them to, but if they want it, they will have it. The only time they will be required is if they're moving from one area to another or going to a hearing or that such a type thing. That being said, I'll field some questions if you guys have any, if I can answer it.
How many more test results are you waiting on?
So what did we have, approximately 50, Chief, that we had to retest, approximately 50? They were tested this morning. They were tested initially, but some reason, we don't know the reason, the test didn't come out and they had to be retested.
How do we find out if our loved one tested positive?
We've been notifying everyone that's in here with their tests.
And I have not been notified. I've been at 52 days.
If they tested positive, they have been notified. We're working on getting everyone notified that was a part of this process, including our employees. That's a lot of people. So we've been reaching out to those who tested positive first, obviously.
And the person that's in the hospital, is that the one inmate that wasn't a systematic?
I can't hear you, Tracy. I was speaking.
Is that the one inmate that you said that wasn't a symptomatic?
He was one of the initial first ones that we observed. He had an underlying health condition, multiple health conditions. Obviously, we know from what we've learned on this, watching on TV, that those are the people who are most susceptible to this. So we took that very precautionary, and we moved into a facility where he could have better medical at that time. Anyone in our facility that has anything similar to that, we're going to be very cautious in that, and we will move them to a hospital immediately. We do take temperatures twice a day, and the inmates can contact us if they have any of these symptoms at all. We're taking this very serious with the inmates and also our employees.
We've had some inmates, community members reach out to us, family members of inmates concerned, one in particular regarding clothing in there, and an inmate stating that he hadn't had a change of clothes
I'm not aware of that being an issue. Bob, can you speak to that?
They get them prescribed and laundry stuff on a regular basis. They get it way more than 7 days.
Well, most people have never been inside the Benton County Jail. This is one of the most clean jails around. We've always taken cleaning very seriously. We have several Clorox machines that we run. Clothing and all that is all disinfected. We've always been vigilant for that, not just for COVID, but just having a facility like this in general. It could be really bad if we got any type of disease in there. So we work on that all the time, not just during COVID.
We also had a fiance of an inmate reach out saying that she was expressing some masks to you guys for use. Is that something you can use? Do you have enough masks for everybody?
We could use more masks. Right now we have enough, but if this goes on over an extended period of time, we're probably going to need more masks.
So if someone sends them in, you guys will
Absolutely, yes.
And there has been no death related to this in Benton County Jail.
I can't hear you.
There's been no death related to this.
No, there has not.
I got an email from someone today, an anonymous email, from me with some weird name, saying that they may have died here.
No, that is not true.
You talk,
Of those 63 inmates that are asymptomatic, are they all being isolated together or separate?
Yes,
Okay.
as can be. Not all inmates can be put together. We pre-planned this ahead of time. We have empty areas of the jail that we anticipated this could happen, and we prepared for that. So yes, they will all be isolated, and the deputies in those pods, our initial plan was based on what the CDC and the Arkansas Health Department had advised us. If you had employees that tested asymptomatic, they would work in those pods. The ones that we do have, that's where they will be going. Obviously, we'll probably have to have more than that based on the number. But yes, we will do a separation from those who tested positive versus negative. And within those areas, we'll have other areas of separation based on why they're here to start with.
You talked about, you said procedures dated back to March. Can you talk a little bit about the progression of your guys' procedures as maybe more tests have come back throughout that time?
I don't know that there's been any dramatic changes. We've had these steps in place the whole time. They're just now getting really implemented. I'm not sure exactly what you're referring to. That could.
Well, you said you guys started stuff back in March, and then now you're starting to isolate
So
people.
yeah, so we worked hand in hand with the judges and the prosecutor's office, and also the local area law enforcement. The judges started helping us to release nonviolent people here on felonies that were nonviolent in nature and misdemeanors. And we had been reducing our number this whole time, getting it down so that we could open up areas that we could keep sanitized and have separation and have people, when they come into the facility, that we could put them in a separate area and for 14 days if we could. And once determined that they didn't have symptoms, then we would move them to other areas of the jail. That has worked very well. We're going to continue to do that. And that's really the main thing is changed. Our numbers have come down, and we've been able to be prepared for what's happening today.
Okay, and then you say inmates were able to get their temperatures checked or get their symptoms checked back in March. What's been the delay throughout that time now getting positive tests back? Is that
We've had like I said, all these are asymptomatic. They've had no symptoms. They've had no temperature. It wasn't until we had one, or I think we have two, that had underlying conditions and had a symptom. That's when it prompted us to test those individuals and anyone that was around them, including employees. And that was the first round of tests that we did. That prompted us to go ahead and test the entire facility and all of our employees to see where we stand on this.
So to clarify, you began testing when you found someone with symptoms?
Yes.
how many inmates are in the jail today?
What's our number today?
It was 379 this morning.
379?
Are you doing any more, besides that retesting, are you going to test any more inmates? Or
I can't hear you.
besides the retesting, are you testing any more inmates?
We've been in talks with the health department whether we're going to test everyone coming forward and isolate them until we know. The issue with that is we can't test them right away. We'd have to put them in a separation for X amount of days. They haven't told us what those days would be, because you could take a test and they could actually have the COVID, but they're not going to test correctly until they've had it for a few days. So we're working through that with the health department, exactly how we're going to handle that going forward.
We got a tip from someone that inmates have to have money in their commissary in order to be treated and see a doctor with COVID. Obviously,
No, that is not correct. You do not have to have money. You can contact the doctor anytime you want.
Okay,
Those are two separate things. Commissaries for items.
got it.
I guess along guidelines and protocols that you guys are following, especially with regards to the masks, how many masks do you guys have, and how often are you making inmates change those if they're wearing them at all?
We have several hundreds, probably about 500 right now. I did place an order today for some bandanas that we're going to give to the inmates to use that we can cycle through and cleanse. And the problem with some of the masks, we can't put some of the masks. I see a lot of the masks you guys are wearing are fine, but a lot of the masks, obviously you can't have in a facility because they get creative with uses for those masks. But we're going to do the bandanas. We've been told that that at least will keep them from putting the droplets out themselves. So that we're doing anything we can. If we can get donations for masks, we will certainly put those to use, anything that we can do.
And how are you sanitizing everything? Are you wiping stuff down every day, or kind of?
So this facility has always been very sanitized, but we're doubling that effort. We have a Clorox 360 machine, and we have another one, I believe, that the county judge is loaning us. The county's tried to purchase more. Of course, those are all on backlog. We do have enough chemicals to keep those running for a while. So that'll be one of the weapons that we use in keeping the jail clean. And obviously your standard bleach on the floors and common areas that get touched, we're making sure that those get cleaned multiple times a day. And we're doing everything that we can to make sure everyone's safe while they're here, including the employees.
And are the inmates wearing, are some inmates wearing masks in their pods?
Yes. You can't make them wear it, but we offer it to them if they want it.
They're not wearing them in the pod. They're wearing them when they get out of the pod.
Yeah.
I was watching
Yeah,
court,
from
and I
moving
know
from
that-
point A to point B.
I've been watching court and I've been seeing them with masks on, I know that.
Yeah.
Let's bring them back in the pod. That's where we're waiting on the
Okay.
on the bandana.
Bandanas, yeah, we'll replace that.
I guess in regard to all the asymptomatic cases, at what point did you guys know you had a problem, and to now?
Mondays when we finally got those first test results back, that we realized that there could be a large issue, and it is a large issue. Fortunately in this, we only had one that's had to go to the hospital, and we've been very proactive in our steps getting ready for this. And it's unfortunate this has happened here, but I think we've been very fortunate for a facility as large as this one that we have avoided this as long as we have. And I'm proud of all the work that's been done, not just by the people here, but county government and city governments and the health department. Everyone has been.
Notified if they're test positive?
Yes, they are.
Okay.
Yes. And I believe a lot of them are being notified. If they haven't been, they're being notified right now. We got a lot of these results this morning.
Okay.
That's what the delay has been. Anything else, guys? All right. Thank you, guys. Thank you, guys.